You are watching McLaren Port Huron Today's Health Program, and today I'm speaking with fellowship-trained orthopedic spine surgeon Ryan Goodmanson about conditions that affect the spine, and in this segment we're going to talk about instability. So, Dr. Goodmanson, how would you describe instability?
Sure. Instability in the spine is called spondylolisthesis, specifically in the lower spine. This can come about because of several different reasons, but most of the time it's due to degeneration within the spine. Degenerative spondylolisthesis is very common. Other things that can cause it are trauma or fracture, as well as just congenital differences within the spine of people.
So what kind of symptoms would someone have?
Over time, back pain is one of the symptoms that people will have from this. They may have radicular pain or pain that goes down their legs, pain that goes into their buttock region, or even weakness and numbness and tingling in their legs as well.
So you had mentioned trauma. So for someone that has a trauma, are the symptoms any different?
No, they can be very similar. The back pain component can increase, obviously, if there's a traumatic injury. However, the other symptoms, the numbness, tingling, and even pain that goes into the buttock and down the legs can be very similar for those patients as well.
So how do you diagnose this condition?
We always start with a very thorough history and physical exam on a patient, ask them questions regarding their condition, how long it's been going on, and what their symptoms are. We then move to dynamic type imaging, and so we will do x-rays in flexion and extension of a patient, of their lumbar spine, to see if there's motion between the segments of the spine. If there's too much motion, we diagnose that as spondylolisthesis. And that can cause all the symptoms that we talked about. From there, patients will usually need advanced imaging in the form of MRI or CT scan.
So what are the treatment options?
Usually, if there's too much instability, meaning that the spine shifts too much, that needs to be stabilized. Anything that's unstable needs to be stabilized. That would be in the form of a fusion. Fusion, and we can show a model here, is forcing essentially two bones to grow together. The way we do that in the spine is with screws, rods, and these fun little things called cages. What we do is we place these into the spine to stabilize the two segments that are unstable, and the patient then will grow those bones together. We put bone graft in there of their bone, and we stabilize those segments so that it no longer shifts around for the patient.
So someone that maybe doesn't have that severe of an instability, are there some non-surgical treatment options as well?
Definitely. If stability doesn't meet the criteria as being severe, we can always do conservative measures for the patient, including physical therapy for core strengthening and strengthening of the muscles surrounding the spine. They could explore doing injections in the spine to decrease the inflammation that can happen around the nerves, and ultimately exercise and a healthy diet.
So for this type of procedure that you just explained, what would be the recovery time for a procedure like this?
I still use the rule of threes: 3 days, 3 weeks, and 3 months. Usually about 3 days after surgery, you feel like you had surgery. And usually the patient who has a fusion like this will stay in the hospital for one night and then go home the next day. After about 3 weeks, they're feeling good enough to get around on their own and get back to kind of normal life. And then in 3 months is about the time it takes for the bone to heal and to actually fuse together.
So for someone that maybe has, thinks this may be a condition, what are some of those symptoms that you would say you need to get in to see me as soon as possible?
Most of the patients that I talk to actually complain of feeling unstable in their spine. When they lean forward or when they lean back, they feel a sensation of instability. Now that could be muscular imbalances, but the only way to really tell is to get in and be checked out and have x-rays. Some of the other symptoms include numbness and tingling in your legs, weakness in your legs. The emergent symptoms being bowel or bladder symptoms, bowel or bladder incontinence, or severe constipation or difficulty with urination. Those are emergent signs and symptoms that you would need to go to your emergency department for.
Are there patients that may not be eligible for a lumbar spinal fusion?
There are. It depends on a patient's age, comorbid or conditions that may preclude them having surgery. Osteoporosis can be a problem for this, as we need the bones to grow together, and so we will try to optimize patients as much as we possibly can beforehand. And we will use a kind of multimodal approach to where we elicit the help of their primary care doctors and any other doctor they may see, so that we can help them and support them through this process.
Well, this has been really great information for our audience, but we do need to take a short break.
Thank you, Kelly.
And this concludes the segment of McLaren Port Huron Today's Health. If you would like to make an appointment with Dr. Goodmanson, you can call his office at the number on your screen or request an appointment through the website. If you would like to watch other videos on health conditions, just visit our website at www.mclaren.org/PHTH. This is Kelly DiNardo for McLaren Port Huron Today's Health.